Hello, my name is David Coughlin, and I'm an associate professor and movement disorders neurologist here at UC San Diego.
And my name is Vanessa Goodwill. I'm an assistant professor and neuropathologist at UCSD. And me and Dave, along with Dr. Subhojit Roy, run the UCSD ADRC neuropathology core. So Dave, why is brain donation important and how does it contribute to our scientific understanding?
So brain donation is extremely important because the ability to look under a microscope at the brain changes is really the definitive way to diagnose neurodegenerative diseases like Alzheimer's disease, dementia with Lewy bodies, or frontotemporal dementias, and other conditions too. Sometimes during life, a patient's diagnosis might be uncertain, or in some cases, there might be different pathologies that can show up with the same types of symptoms. So being able to look at the brain provides some of those answers to what the underlying cause was initially. So we can use those pathological findings too to better understand how we can diagnose living patients earlier, more accurately, and in the future, those brain samples themselves can be used to help us understand the processes that lead to disease in the first place, hopefully to develop new tests to help with diagnosis and improve therapies to treat these conditions. So we often get questions about what's involved with the brain autopsy process. So Vanessa, could you explain a little bit?
Sure. So when a person who has been enrolled in the ADRC brain donation program passes away, either a family member, a nurse, or other representative calls a phone number that we provide. There are people that answer that call 24 hours a day, 7 days a week, and we arrange everything after that. That includes transportation to UCSD, where we do the brain removal and also remove any other tissues that have been consented for donation. After this, we will transport the body to a facility of the family's choice. And you can let us know if there are any special considerations based on your wishes or your religion. But a standard brain donation is done very carefully and does not preclude traditional funerals, including open casket ceremonies. So many people also ask about what happens after the brain donation. Can you explain that a little bit?
Sure. So family members will receive a report of the findings that we see in the brain after that report is completed. Normally, this takes a few months to finish because the processes that are necessary to be able to see those pathologies in the brain take a little bit of time for us to complete. Members of our team are available if people would like an in-depth explanation or to contextualize any of the findings that we see in the report. The remaining brain tissue is cataloged and stored securely on the UCSD campus, where it can be used with scientists, sometimes here at UCSD, but we often are collaborating with other centers around the world to help address important scientific questions about how Alzheimer's disease and other conditions start or progress and how we can better diagnose and treat them. So Vanessa, what do you think the most important thing that participants and their families need to know about this process?
First of all, we want everyone to know that we're very grateful for anyone who is considering brain donation. The chance to study human disease using human samples is really invaluable. So we want people to know that we have this gratitude and that we do our best to make sure that participants and their families are treated with respect at every step of the way. And we also try and make the process easy for people, where all their families have to do is just call the one phone number we provide after the participant passes. So it's really important, first of all, that participants tell their families that they have signed up for this program. And also time is important. So brain donations that are obtained quickly after passing can result in samples that can be used for more sophisticated analyses and research. So it's really important that family members call the phone number as soon as they can after their loved one passes.
So, but Vanessa, what if there's somebody who used to be with the UCSD ADRC and wants to donate, has moved outside of the San Diego area?
Sure, so that does happen sometimes. And please let us know if you are moving away. Depending on the location, we may be able to still accommodate the donation at UCSD. But additionally, we also belong to a network of other ADRCs. And sometimes they can help facilitate the donation as well if you end up moving closer to a different research center. And lastly, Dave, what would you say are the risks and benefits of being involved in the ADRC brain donation program?
Well, I would say that the benefits are largely that family members will receive a comprehensive report that definitively details the neuropathological findings and we'll explain the likely causes of the person's underlying condition. We continue to view neuropathological reports as really the gold standard in diagnosing neurodegenerative disease. Risks should be fairly minimal. We do a great deal to secure that all personal data is kept secured and private. You and your family will also know that you are actively contributing to the advancement and understanding of Alzheimer's disease and related dementias in a way that we hope will result in better treatments in the future. But if you have any other questions, please reach out, contact us through our ADRC's website. And again, we thank you for your attention and considering being part of this program.